Welcome to PharmaCourse. At PharmaCourse, we are dedicated to revolutionizing the pharmaceutical sector through innovation, education, and strategic collaboration. Our platform is designed to empower industry professionals, support cutting-edge research, and drive global transformation in healthcare.
Welcome to your deep dive into continuous improvement. You've sent over quite a collection of articles and notes on operational excellence in the pharmaceutical industry.
Oh, wow.
Clearly, you're serious about making a difference. So today we're going to explore the ins and outs of CI, its impact on pharma, and even uncover a fascinating story about how building cars can teach us about making life-saving drugs.
Very cool.
Intrigued. Let's get started.
What's fascinating here is that you've highlighted some compelling case studies,
Yeah.
like the one about Genentech's journey with CI.
Oh, yeah.
They really turned things around, going from struggling to meet demand for a critical cancer drug to exceeding production goals while cutting waste.
Okay, let's unpack that.
Yeah.
First things first, for anyone who's new to this world,
Yeah,
what exactly is continuous improvement?
it's not just another business buzzword.
Right.
Continuous improvement, or CI, is a mindset,
Okay.
a commitment to constantly seeking better, more efficient ways of doing things.
Right.
Think of it as a journey of small, incremental changes that add up to a significant impact over time.
I like that.
The Japanese call this kaizen.
Like those tiny but mighty improvements that help Genentech boost production of that cancer drug.
Exactly.
Yeah.
And in the pharmaceutical industry, CI isn't just a good idea, it's often a regulatory requirement.
Oh, wow.
Lives are at stake, so operational excellence is non-negotiable.
That makes perfect sense. You can't cut corners when it comes to people's health.
Right.
Now, you've highlighted some key benefits of CI, especially in pharma:
Yes.
increased productivity, enhanced quality, cost savings, risk mitigation.
Mm-hmm.
Which one jumps out at you as particularly impactful in this field?
They're all interconnected.
Yeah.
But in the pharmaceutical world, I'd say enhanced quality is paramount.
Okay.
Think
Yeah.
about it. A defective drug can have devastating consequences.
Oh, absolutely. I'm thinking back to that article about the poka-yoke concept.
Oh, yeah.
That blew my mind. Designing tools to prevent errors, like a syringe that can only be filled with the correct dosage.
That's a perfect example. Poka-yoke, or mistake proofing, is a brilliant way to minimize human error, a crucial factor in ensuring patient safety.
Wow, I can see how that would be a game changer in pharma, where even the smallest error can have major repercussions.
Absolutely. And that's where CI really shines.
Yeah.
By relentlessly focusing on improving processes, eliminating waste, and building a culture of quality, companies can dramatically reduce the risk of those errors happening in the first place.
We've seen that in action with the Genentech case.
Yes.
By applying lean principles, they were able to reduce medication errors by a staggering 78%. That's not just good business, it's literally saving lives.
Precisely. And that brings us to another crucial aspect of CI, lean methodology.
Okay.
It's a fascinating approach with roots in post-WWII Japan, and you wouldn't believe where it started, with Toyota.
Wait, so building cars can teach us about making life-saving drugs. Now that's an aha moment.
It's pretty remarkable, isn't it?
Yeah.
Toyota's production system, or TPS, revolutionized car manufacturing by ruthlessly eliminating anything that didn't add value to the customer.
So no unnecessary bells and whistles on those early Toyotas.
Exactly. It was all about efficiency and eliminating waste, which they called Muda.
Buddha.
And guess what? Those principles translate beautifully to pharmaceuticals.
Okay, I'm hooked. Tell me more about this Muda and how lean helps eliminate it.
Well, Toyota identified 8 key wastes,
Okay.
and some of them are especially relevant to your interest in pharma.
Yeah.
Overproduction, for example.
Mm-hmm.
Making more medication than needed leads to expired stock storage costs. It's wasted money and resources.
Right.
Then there's the waste of defects, which, as we've discussed, is a major concern in this industry.
It all makes sense now.
Right.
And you've highlighted some specific lean tools in your notes.
Yes.
Things like value stream mapping and the 5S methodology.
Uh-huh.
How do those help tackle these wastes?
Value stream mapping is like creating a visual map of the entire journey of a drug, from raw materials to the patient.
Okay. This helps pinpoint bottlenecks and inefficiencies, just like finding those traffic jams in your production line.
So you can spot those areas where things get stuck and find ways to make the whole process smoother and faster.
Exactly. And the 5S methodology is about creating a clean, organized, and efficient workplace.
Okay.
It sounds simple, but it can have a profound impact on reducing errors and boosting productivity.
So a tidy lab equals fewer mistakes and more efficient drug production. Sign me up.
It's not just about aesthetics.
Right.
A well-organized workspace reduces stress, makes it easier to find what you need,
Yeah,
and minimizes the risk of errors.
makes sense.
And then there's Gemba Walks,
Yumbo walks.
which is all about managers getting out of the office and spending time where the real work happens,
Oh.
observing, talking to employees, and identifying opportunities for improvement.
So it's about getting out of the ivory tower and into the labs where the magic happens.
Exactly. That's where the real insights are, by observing firsthand how things are actually done.
Managers can identify opportunities that they might never have seen from behind their desks.
This is fascinating. So Lean is all about streamlining processes and eliminating waste.
Yes.
Now, you've also mentioned Six Sigma quite a bit.
Mhm.
It's data-driven, right? How does it fit into the whole CI picture?
If Lean is the sprinter, Six Sigma is the marathon runner.
Oh, okay.
It's about reducing variation and eliminating defects through rigorous data analysis.
Uh-huh.
Think of it as the detective of CI, using statistics to hunt down those hidden problems.
So Lean speeds things up, and Six Sigma makes sure they're done right.
Precisely.
They sound like a pretty powerful duo.
And that's why Lean Six Sigma, which combines the best of both methodologies, has become so popular.
Okay.
But let's not get ahead of ourselves.
Okay.
Let's break down Six Sigma a bit. I know it can sound intimidating, but it's really not that complicated.
That would be great.
Yeah.
Can you give us a simple explanation of how it works, especially in the context of pharmaceuticals?
Of course. One of the key concepts in Six Sigma is DMAIC, which stands for Define, Measure, Analyze, Improve, and Control.
Got it.
Think of it as a structured problem-solving method for improving processes.
So it's like a scientific method for making things better.
Exactly. And another important concept is CTQ,
CTQ.
which stands for Critical to Quality.
Okay.
It's about identifying what really matters to the customer, in this case patients, and then focusing your improvement efforts on those key attributes.
So in the pharmaceutical world, CTQ would be things like safety, efficacy, and affordability.
You got it.
Okay.
And Six Sigma provides the tools and techniques to measure those things, track their performance, and identify any deviations from the desired standard.
Okay, I'm starting to get the picture.
Good.
But you mentioned that Six Sigma uses statistical analysis.
Yes.
Can you give us an example of what that looks like in practice, preferably in a pharmaceutical setting?
Absolutely. Imagine you're trying to improve the consistency of a drug's potency. You could use statistical process control, or SPC,
SPC.
to track the potency of each batch over time. By monitoring these charts, you can quickly identify any trends or patterns that suggest a problem is developing.
This is like having an early warning system for your drug production process.
Precisely. It allows you to catch problems before they become major issues, which can save a lot of time, money, and potentially lives.
Okay, my mind is officially blown. Lean, Six Sigma, Pokio. It's amazing how these seemingly disparate ideas can come together to create such a powerful approach to improvement.
It's a testament to the power of CI to adapt and evolve.
Yeah.
And we haven't even touched on the human side of CI yet,
Oh.
which is arguably the most important aspect of all.
Well, that's a perfect segue to our next topic. We've talked a lot about tools and techniques, but what does it really mean to create a culture of continuous improvement?
That's where it gets really interesting.
I knew you were going to say that.
Right.
All right, spill the beans. What does it take to build a thriving CI culture?
It starts with leadership.
Okay.
We'll delve into that in detail later.
Yeah.
But suffice it to say, you can't have a CI culture without leaders who embody the CI mindset and empower their teams to embrace it.
That makes perfect sense. If the people at the top aren't fully on board, why should anyone else bother? Okay, stay tuned, folks, because when we come back, we'll be diving deep into the crucial role of leadership in driving a successful CI transformation. You won't want to miss it. We're back and ready to tackle the human side of continuous improvement, specifically the crucial role of leadership in building a thriving CI culture.
Right.
It's all about setting the tone, empowering teams, and leading by example, right?
Absolutely. Leadership is the linchpin of any successful CI transformation.
Yeah.
You can have the most sophisticated tools and techniques, but without strong leadership, it's all for naught.
So let's talk leadership. What does it look like to be a CI leader, especially in the high-stakes world of pharmaceuticals?
Yeah.
I was thinking back to that article you highlight about Johnson & Johnson's CI journey.
Yeah.
Their CEO at the time, Alex Skorsky, seemed to really embody this leadership style. He was passionate about quality, committed to empowering employees, and constantly pushing for improvement.
That's a great example. CI leaders like Alex Skorsky don't just talk the talk, they walk the walk.
Right?
They embody the CI mindset in everything they do, setting the tone for the entire organization. They're constantly looking for ways to improve their own work, and they inspire that same mentality in everyone around them.
So it's not just about giving orders, it's about being a role model, demonstrating the value of CI in their own actions.
Precisely.
Yeah.
And remember that article about psychological safety in the workplace?
Yeah.
That's another key aspect of CI leadership.
Okay.
They create a culture where it's safe to experiment, to take risks, and even to fail without fear of punishment. They understand that innovation requires experimentation, and experimentation inevitably involves some level of risk.
That makes sense. If you're constantly worried about making mistakes, you're less likely to try new things or speak up with new ideas.
Exactly.
Yeah.
CI leaders create an environment where people feel comfortable sharing their ideas, even if those ideas are a bit unconventional.
Yeah.
They foster a culture of open communication, collaboration, and trust.
I love that idea of creating a safe space for people to share and experiment. It
Right.
sounds like CI leaders are comfortable with a certain level of controlled chaos.
That's a great way to put it. They understand that you can't have innovation without a little bit of chaos.
Yeah.
But it's not about letting things spiral out of control. It's about creating a framework where people feel supported and empowered to take risks, learn from their mistakes, and continuously improve. Think of it as structured experimentation.
That makes a lot of sense. Now, we talked about Lynn's concept of unutilized talent as a form of waste.
Right.
It seems like CI leaders would be particularly attuned to this, making sure everyone has a chance to contribute their skills and ideas.
Absolutely.
Yeah.
CI leaders are passionate about developing their people. They invest in training programs, provide opportunities for mentorship and coaching, and create a culture where everyone is constantly learning and growing.
Yeah.
They also make sure that everyone has the resources and support they need to succeed.
They're like talent gardeners, carefully cultivating a thriving ecosystem of innovation and continuous improvement. Okay, I'm getting a good sense of the mindset and values of a CI leader. But what about the practical stuff? What specific actions do they take to drive CI forward?
One of the most important things CI leaders do is clearly articulate the vision for CI.
Okay.
They don't just throw around buzzwords like efficiency and improvement. They paint a compelling picture of what a CI-driven organization looks like, how it benefits everyone involved, and how it aligns with the company's overall goals and values.
So it's about providing clear direction, a sense of purpose, and getting everyone excited about the journey.
Precisely. And it's not enough to just articulate the vision you have to translate it into action.
Yeah.
CI leaders set specific, measurable goals for improvement. They break down those big, audacious goals into smaller, more manageable chunks, and they create clear roadmaps for achieving them.
So it's about setting ambitious targets, but also providing a realistic and actionable plan for getting there.
Exactly.
Mhm.
And CI leaders don't just set goals and forget about them.
Right.
They track progress closely, using data and metrics to monitor performance, identify areas where improvement is needed, and celebrate successes along the way. Remember that DMAIC process we talked about in Six Sigma?
Yes.
Define, measure, analyze, improve, control. A good CI leader embodies that process in everything they do.
They're constantly analyzing, adjusting, and improving just like the processes they're trying to optimize. It's starting to sound like being a CI leader is a pretty demanding job. What kind of skills and qualities are essential for success?
It's definitely not for the faint of heart.
Yeah.
CI leaders need a unique blend of leadership skills, technical knowledge, and a deep understanding of human behavior.
I can see how all three of those would be crucial. Can you break those down for us a bit? What specific leadership skills are we talking about?
On the leadership side, they need to be visionary, inspirational, and persuasive.
Okay.
They need to be able to rally people around a shared vision, build trust and buy-in, and motivate teams to embrace change.
Right.
They also need to be decisive, able to make tough calls and hold people accountable for results.
That makes sense. You can't drive change without a strong and decisive leader at the helm.
Right.
But you also mentioned technical knowledge. How important is that for a CI leader?
It's essential.
Okay.
CI leaders need a solid understanding of the methodologies and tools we've been discussing. Lean Six Sigma, data analysis, process mapping, and so on.
Yeah.
They need to be able to speak the language of CI, understand the nuances of different approaches, and guide their teams in selecting and applying the right tools for the job.
So it's not just about being a cheerleader for CI. It's about having the knowledge and expertise to actually make it happen.
Exactly. But it's not enough to be a great leader and a CI expert.
Right.
You also need a deep understanding of human behavior.
Okay.
You need to know how to motivate people, build high-performing teams, communicate effectively, and create a culture that supports continuous improvement.
It sounds like they need to be almost like organizational psychologists.
In a way, yes. They need to understand what makes people tick, what drives them, and what barriers they might be facing. They need to be able to create an environment where people feel valued, supported, and empowered to contribute their best work.
Okay, we've talked a lot about what it takes to be a CI leader, but what about the people who are being led? What's their role in all of this?
That's a crucial point. CI isn't a top-down initiative, it's a team sport.
Hmm.
Everyone in the organization has a role to play, from the CEO to the frontline employees.
So it's not just about following orders, it's about actively participating in the process of improvement.
Absolutely. Frontline employees are the ones who are closest to the work, so they often have the best insights into where improvements can be made.
That makes sense.
CI leaders need to create a culture where those employees feel comfortable speaking up, sharing their ideas,
Yeah.
and taking ownership of the process. Remember those gimbal walks we talked about?
Yeah.
That's a great way for leaders to tap into that frontline wisdom.
It all comes back to the idea of empowerment.
Exactly.
Mm.
CI leaders empower their teams to identify problems, propose solutions, and experiment with new ideas. And they make sure to recognize and reward people for their contributions, creating a positive feedback loop that reinforces the CI culture.
So how does a CI leader go about fostering this sense of ownership and empowerment among their team members?
There are many ways, but one crucial aspect is communication.
Oh,
CI leaders are excellent communicators.
yeah.
They're able to clearly articulate the vision for CI, explain the benefits, and get everyone on board with the journey.
Hmm.
They also create clear channels for communication, ensuring that information flows freely up and down the organization. They make sure that everyone understands the goals, the progress being made, and how their individual contributions are making a difference.
So it's about creating a culture of transparency and open dialogue.
Absolutely. And it's about recognizing and rewarding people for their contributions. When people feel like their ideas are valued and their efforts are appreciated, they're more likely to embrace CI and go the extra mile.
It's amazing how all of this comes back to people, isn't it?
Yes.
It's not just about tools and techniques. It's about creating a culture where everyone is aligned around a shared vision for improvement.
You're exactly right. CI is ultimately a human endeavor, and its success depends on the commitment, creativity, and collaboration
Yeah.
of everyone involved.
Right.
But it's not always easy. There are some common misconceptions about CI that can trip people up.
Oh, I'm sure there are.
Hmm.
What are some of the biggest misconceptions about CI? What are some of the things that people often get wrong?
One of the biggest misconceptions is that CI is a one-time event, a quick fix that you can implement and then forget about. In reality, CI is a continuous journey, a never-ending quest for improvement. It requires ongoing effort, vigilance, and a willingness to adapt and evolve as new challenges and opportunities arise.
So it's not a destination, it's a way of life.
Precisely. Another misconception is that CI is all about cutting costs and doing more with less.
Okay.
While efficiency and cost savings are certainly important benefits of CI, they're not the only goals. CI is also about improving quality, enhancing customer satisfaction, boosting employee morale, and creating a more sustainable and resilient organization.
So it's about holistic improvement, not just squeezing every last penny out of the system.
Exactly. And another common misconception is that CI is solely a top-down initiative driven by management.
Okay.
As we've discussed, CI is most effective when it's embraced by everyone in the organization, from the CEO to the frontline employees. It requires a culture of collaboration, empowerment, and shared ownership.
It's a team effort, not a solo mission.
Absolutely. And finally, one of the biggest misconceptions is that CI is only relevant for manufacturing companies. In reality, CI can be applied to any type of organization in any industry.
Oh, wow.
Whether you're in healthcare, education, government, or even the nonprofit sector, there's always room for improvement.
That's encouraging. So no matter what kind of work you do, CI can help you do it better, smarter, and more effectively.
You got it. And that brings us to our final segment. We've covered the theory, the leadership, the culture. Now let's see CI in action.
I'm ready for some real-world inspiration. When we come back, we'll explore some fascinating examples of CI making a real difference in the pharmaceutical industry and beyond. Stay tuned.
All right, we're back and ready to see continuous improvement in action. I'm excited to see how these principles are being applied in the real world, especially in the pharmaceutical industry.
You and me both. We've talked a lot about the theory and the mindset, but there's nothing quite like seeing CI come to life in real-world examples.
Exactly. So hit us with some inspiring stories. Where is CI making a real difference in the pharmaceutical world?
One area where CI is having a huge impact is in drug discovery and development.
Traditionally, this process has been notoriously slow and expensive with a high failure rate.
Yeah.
But companies are now using CI principles to streamline the process, reduce costs, and increase the chances of success.
Oh, wow.
It's a win-win for everyone, especially patients.
That's encouraging to hear. Can you give us an example? I'm particularly interested in how CI is being used to speed up the development of new drugs.
Absolutely. One company that comes to mind is Eli Lilly and Company.
Eli Lilly.
They've been using lean principles to accelerate their drug discovery process, and the results have been impressive.
Okay.
They've created a more agile and collaborative research environment, which has enabled them to identify and validate new drug targets much faster than before.
So they've created a kind of CI fast track for drug discovery.
Exactly. By eliminating unnecessary steps, streamlining communication, and empowering scientists to make decisions quickly, they've been able to significantly reduce the time it takes to bring new drugs to market.
That's incredible. I can only imagine the impact that has on patients who are waiting for those life-saving treatments. What other examples come to mind? I'm also curious about how CI is being used to improve the manufacturing process.
Well, another fascinating example is how Pfizer is using Six Sigma to improve the efficiency and accuracy of their vaccine production.
Okay.
By meticulously analyzing data from every stage of the process, they've been able to identify and eliminate sources of variation that can lead to defects and delays. This has helped them to produce vaccines more efficiently, with higher quality and less waste.
So it's about using data to pinpoint those hidden inefficiencies and then systematically eliminating them.
Precisely. And it's not just about making things faster and cheaper.
Right.
It's also about ensuring that every dose of the vaccine meets the highest standards of quality and safety.
That's reassuring to hear, especially in a world where vaccine hesitancy is such a concern. People need to know that these medications are being produced with the utmost care and precision.
Absolutely. And CI is playing a crucial role in building that trust and confidence.
These examples are truly inspiring. It's amazing to see how CI principles can be applied to such complex and critical processes. But I'm also curious about how CI is being used outside of the pharmaceutical industry. You mentioned earlier that CI is applicable to any organization in any industry. Can you give us some examples of how CI is making a difference in other sectors?
Of course. One sector where CI is gaining traction is healthcare.
Okay.
Hospitals and healthcare systems are using lean principles to improve patient flow, reduce wait times, and eliminate medical errors. For example, Virginia Mason Medical Center in Seattle has been a pioneer in applying the Toyota production system to healthcare with remarkable results.
So they're using the same principles that revolutionized car manufacturing to improve patient care. That's fascinating. How does that work in practice?
Well, they've implemented a number of innovative practices, such as using visual management boards to track patient progress, standardizing procedures to reduce variation, and empowering nurses with frontline staff to identify and solve problems.
It sounds like they're creating a more efficient, patient-centered, and ultimately safer healthcare environment.
Exactly. And CI is also making its mark in the world of education.
Oh, wow.
Schools and universities are using CI principles to improve student outcomes, streamline administrative processes, and create a more engaging and effective learning environment.
I'm intrigued. Can you give us an example? I'm always interested in how we can improve our education system.
Well, one interesting example is how some schools are using lean principles to improve the process of getting students the support they need. By creating a more efficient and responsive system for identifying and addressing learning challenges, they're able to help students get back on track more quickly and achieve their full potential.
That's a great example of how CI can be used to address systemic issues and create more equitable outcomes.
Absolutely. And it's not just about improving processes and systems.
Right.
CI is also about fostering a culture of continuous learning and improvement. It's about empowering everyone to identify problems, propose solutions, and experiment with new ideas. It's
Yeah.
about creating a workplace where people feel valued, supported, and inspired to do their best work.
I love that vision. It's not just about efficiency and productivity. It's about creating a more fulfilling and meaningful work experience for everyone.
You got it. And that's what makes CI so powerful and transformative. It's not just a set of tools and techniques. It's a philosophy, a mindset, a way of life.
This has been an incredible journey. I feel like I've gained a whole new understanding of continuous improvement and its potential to make a real difference in the world. Thank you for sharing your expertise and insights.
It's been my pleasure. Remember, the journey of continuous improvement is never ending. There's always room to learn, grow, and make things better.
Well said. And to our listener, we hope this deep dive has equipped you with the knowledge and inspiration to embrace CI in your own life and work. Whether you're in pharmaceuticals, healthcare education, or any other field, the principles of CI can help you achieve remarkable results.
Keep that CI mindset going. Challenge the status quo, ask questions experiment, and never stop learning.
That's the perfect note to end on. Thanks for joining us on this deep dive into continuous improvement. Until next time, keep striving for excellence.